I live in Italy. I grew up in the United States. I moved to Italy 15 years ago. I married an Italian woman. I am now an Italian citizen and an American citizen. I worked in the United States for most of my life. I went to school and I lived in the United States. I wholly recommend the Italian style of universal health care for several reasons. Number one, the money that I used to spend on health care, insurance, co-pays, and policy payments, I don't have that over here. Yes, some of the tax that I pay supports the universal health care, but that is much less than what I had to pay out of pocket to the healthcare system when I was living in the United States. The money that I used to have to spend on healthcare, whether I used it or not, now I use in terms of supporting the Italian economy in other ways. The second thing is, even though I fortunately have not had any major medical problems, if I do have some minor, which I do, issues, I can go to my general practitioner any time of the week. And if I want to spend half an hour waiting in the waiting room for my turn, I can see my general practitioner for free. This is very good because it encourages me to monitor and to seek help if I'm starting to have some feelings of illness instead of waiting. So I go immediately, I get really good care, and also I get referrals if the physician, my GP, thinks that this would be helpful in terms of the diagnosis and any treatment. While I have been fortunate in not having a serious illness, my wife did have a serious illness where she needed to have surgery. She was able to have the surgery, be seen by the physician, have an excellent surgical team, and recover with minimal, especially compared to the United States, costs to her, which was very good because then the financial burden of becoming ill out of no fault of one's own is eliminated. And since the monthly net average income over here in Italy is about 1,900 euro, if one was to have any kind of serious, and of course, unfortunately it happens, serious illnesses, and you had to pay out of pocket substantial amounts of money for that treatment and aftercare and medication, we would see, of course, that one's financial state would be in dire need and would be very stressful, which could even contribute to further illnesses. Having the Italian government and the healthcare system cost practically nothing except for what the taxes were is such a relief for the Italian people, and it allows access for whatever problems you have to be non-restrictive in terms of costs, which of course is a huge benefit because people get treated for and intervened early on in a medical problem, and therefore the later costs of more serious problems is eliminated or prevented because people go in to see the doctor and have medical interventions done quickly and expertly. The other thing is for medications, there is a co-pay, but they're very low, and even though I don't use them, because I am retired, I would have no cost for my medications at all. I wholly recommend a universal healthcare system for the citizens of the United States. I just don't understand how such a wealthy country as the United States, in terms of gross national product, compared to a country like Italy, cannot afford and support a universal healthcare system where they do it so well here in Italy, and I think also other countries in Europe.